Hi everyone, and we're back live here at the Guidewell Insights Lounge at day 3 of Exponential Medicine's conference, and I am delighted to have a special guest with us here today. Let me start by saying my name is Kate Warnock. I have right now Daniel Silberman. Daniel, welcome to the interview.
Thanks, Kate. It's a pleasure to be here.
We're happy to have you. Daniel is the co-founder and COO of MetaConnecta. Daniel, I have a few questions for you. Let's start with, what area of health and medicine most needs to be disrupted in order for real transformation to occur?
That's a great question. You know, with everything that we're seeing here, that so many brilliant minds bringing change, I think there are lots of things that we can see that will have tremendous impact. From my vantage point, being in the telehealth space, I think that certainly is one of the things that will have a dramatic impact in the future of healthcare. I think that providing access to a lot more people than currently have access to basic health. We're not talking about necessarily the most complex problems about health, but basic health to many people, I think over the next decade will probably have the most impact in global terms.
Absolutely, and I know that your company is probably doing a lot to address that, isn't it?
That's right. Well, one of the things we do, MetaConnecta is a leading provider of telehealth services. We do that mainly in Latin America. We essentially provide virtual medical consultations to people there in 5 countries in Latin America. And one of the things that enables us to do is using a platform, a technology platform, and physicians behind it, a network of physicians that we ourselves assemble, is to provide access in a much simpler way, facilitate access for many people that otherwise wouldn't have easy access to basic medical care.
Right, right. All right, great. Next question for you. You know, as technology continues to change the entire healthcare experience, we certainly have been witness to that here at Exponential Medicine. What needs to be done to ensure that the human side of health and medicine isn't forgotten?
Yeah, that's a great point. I think whatever we do with technology, it has to keep the human side as part of ultimately the healthcare delivery that patients are getting. So in essence, technology cannot be a full replacement for the human component that typically or traditionally has been represented by doctors and other providers in the medical system. I think that technology has to complement what's being done. We talk a lot about AI and big data and the impact that potentially those technologies and areas of study will have in, to a certain extent, replacing what doctors and the human side of medicine are doing for patients. But I think that a huge side of it is we are at the end interacting amongst people, and I think that doctors will always play a key role. I think that technologies have to, in a way, integrate with the doctors and the people that provide care to make their work easier, to ultimately help them help patients in a more efficient, in a more prevalent way, in a faster, more effective way. But at the end of the day, it's always about having someone at the other end of the line.
Well, your response takes me to my very next question. It's a great lead-in. You know, of all the innovations we've heard here at XMed, what one thing do you think will most significantly alter the way the average person consumes healthcare over the next decade?
Yeah, that's also very interesting. I think if you think of the average person as maybe you or I or someone who's in the group of people that now are getting some level of healthcare, that would be big data and personalized medicine, precision medicine, where those things will have tremendous impact in the outcomes we get, the people that are already at a certain threshold of care. But if you think of the average person as really the average person, which is there are billions of people in the world that don't really have much access to basic care. I think that technologies that simplify access or give access to people that don't have access today are probably the ones that will have the most impact for that average person. So depends on who you are. I think that different things will get to you faster. I think that if you think of the planet as a whole, maybe access or technologies that facilitate access are the ones that will have the most impact over the next 10 years or so.
Terrific. Well, Daniel, we have a couple fun questions for you now.
Okay.
All right. If you could magically fix one specific problem with healthcare today, what would it be?
I'd say interoperability at the back end. It's one of the things personally, and I don't know if this is necessarily what would be the biggest solution, but I've seen that that's a big problem.
Why don't you describe what that is too?
Yeah, so basically you go to a certain provider, you get exams, then you go to a different provider, you get referred, you need to get the exams again because they're not talking to each other, information is not flowing right. There's a lot of duplicity, a lot of inefficiency. So I think that there are structural things that need to happen at that level that will improve the continuum of care significantly if they are addressed successfully.
You know, are you aware of any solutions that really are looking to, it's not just about data being siloed, it's really being, data also has to be standardized, doesn't it? So that it does flow from one system to the next. You know, what are some solutions or some, you know, advances that you see coming in that way?
Yeah, I've seen initiatives that are impressive in certain countries. I know Sweden has a terrific system where information is basically stored in a single platform, and every provider, every player in the system accesses that platform, so there's a single place, a single repository for information. I'm not saying that's the solution. There are many ways you can come about it, and maybe you can just create conversation points between different systems, but I know that this has been done. I think Israel has also a very effective system where you have a single personal record, and everything that happens gets input into that file in real time, and that facilitates things quite a bit.
Right, right. So it sounds like there's definitely some global models for us to follow, and that's good news, and obviously part of the conversation and the opportunity that I think is here at Exponential Medicine is that they convene people who are, you know, maybe experts, maybe they're Swedish or they're from Israel, and that they can help talk through with entrepreneurs here in the United States and elsewhere, and how to really start making that a global solution instead of just nation by nation. So, all right, one more fun question for you.
Okay.
All right, if you could put one innovation back on the shelf, what would it be and why?
That's a hard one. I'd say I keep hearing everywhere that there are about 4,000 EHRs. So I'd probably take 3,950 of those and put them back on the shelf. I think that, you know, as it relates to the previous question, you know, I don't know why we need 4,000 EHRs. I think it's part of the problem, and I don't know which ones are the better ones, but I don't see a need for so many different systems like that don't coexist, and I think that's one of the things where I think there's way too much waste.
I think you touch on something that I think that's an innovation that many people would agree with you from you know, the conversations that we monitor on social media. Yeah, you'd have a big audience nodding their head right now when they hear you say that. So, well, Daniel, it's been wonderful having you here at the Guidewell Insights Lounge. Thank you for sharing your perspective with us. I hope that you get a lot more for the next day and a half of Exponential Medicine.
I appreciate it, Kate. It's been a pleasure, and it's been very enjoyable.
My pleasure. So we're going to go ahead and bring up our next interview in just a moment. My name is Kate Warnock. We'll be back live in just a second.